Well, it can be a difficult decision to put a loved one in an assisted living home when their health starts to decline. Families try to make the most of it by regular visits and helping with the little things.
But COVID-19 has brought that to a halt, and some are not able to use alternative means to connect with those stuck inside. News 8 Now's Mal Meyer talked to one family about the lengths they'd go to take care of their loved one again.
A good love story starts somewhere. For Carol and Stephen Thompson, theirs began in a bar.
Shorty's up on the ridge.
Since that special day, they've stood by each other's side for more than 50 years, until he started to slow down.
His walking was the big thing.
And some memory issues.
They really couldn't come up with a diagnosis for us.
Finally, around August, some answers. Atypical Parkinsonism and dementia.
He just kind of went downhill.
By October, she knew.
He was never able to recuperate enough for me to bring him home. So he ended up at Mulder.
The West-Salem assisted living facility gave him the care he needed, but she provided so much more.
I had told him that I'd be back for supper.
But she couldn't keep her word.
We had to leave right then.
We were done, and we couldn't even go back down and say bye to him.
Because of the coronavirus and emerging CDC guidelines, visitors had to leave immediately. Since March, special moments have come and gone.
So it was very difficult when the anniversary came along because I was not able to go in to see him at all.
The facility recently started giving out walkie-talkies for people inside and outside to communicate, but it's not enough.
It's hard to get his attention because he's not able to engage with us.
His condition is worsening.
Someone has to be there to prompt him to speak to us through the walkie-talkie.
The family believes that loss of a personal connection has made his health decline even more.
I just see him slipping away every day I go.
They're increasingly frustrated, especially after just last week when Minnesota laid out guidance allowing essential caregivers into long-term care facilities.
I know that there's a shortage of help in nursing homes, so why not let the people who've taken care of them all along come back and help out with that burden.
The La Crosse County Health Department says it's not so simple.
A big debate about quality of life versus life itself.
But the decisions are based on decreasing potential risks.
We remain with not having the ability to have visitors in the physical space of individuals.
The health department acknowledges that some residents can come and go from facilities, but that adds risk.
That risk doesn't just impact that one individual who's in assisted living or long-term care. It can impact everyone in that facility.
But still, they're allowed. So are the staff. That's why the family just doesn't understand. Carol would be willing to wear a mask, get her temperature checked, anything to be on the other side.
Everything. It would mean everything to me. So, and I think it would help him.
In La Crosse County, Mal Meyer, News 8 Now.
Wow, so heartbreaking to watch that. News 8 Now did contact mulder-health-care-facility to ask about the potential for opening up to caregivers, but we have not heard back from them yet.